Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is R.S. Raghu, and with me is Anita Anand, bringing glimpses of the major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment, and more. The headlines. Prime Minister of India, Mr. Narendra Modi, thanks doctors on National Doctors' Day for their services during COVID-19 pandemic. Digital India is a slogan for a stronger India in the 21st century, says Indian Prime Minister. India and Pakistan exchange a list of civilian prisoners and fishermen in their custody. Thailand welcomes its first quarantine-free tourists back to island of Phuket. And in Wimbledon tennis, Sania Mirza and her American partner advanced to second round in women's doubles. As the nationwide free COVID-19 vaccination campaign at government facilities for those above 18 years is going on, we advise our young listeners to get vaccinated and also to help others to get vaccinated. We also advise our listeners not to lower their guard as COVID-19 remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075. And now the news in detail. On the National Doctors' Day, we salute the doctors for their selfless service for humanity during the COVID-19 pandemic. Indian Prime Minister Narendra Modi has said that the government is making efforts to create robust medical infrastructure in the country. He said over 2 lakh crore rupees have been allocated in this year's budget for creating modern medical infrastructure. While addressing the doctors on National Doctors' Day today, Mr. Modi said a credit guarantee scheme worth 50,000 crore rupees has been introduced to strengthen the national health infrastructure in the country. He said more than 22,000 crore rupees have been allocated for creating child health care infrastructure. He said new AIIMS and medical colleges are being set up and medical seats have been increased in the last 7 years. Appreciating the doctors and medical fraternity's role in tackling the COVID-19 pandemic, the Prime Minister said doctors, healthcare and frontline workers have saved many lives during the pandemic. He said India's position is better than several developed countries in terms of per million death and infection rate during the pandemic. Mr. Modi said doctors are dealing with the challenges posed by the mutant coronavirus through their experiences and suggesting innovative measures.
कोरोना से लड़ाई में जितनी चुनौतियां आई, हमारे वैज्ञानिकों, डॉक्टर्स ने उतने ही समाधान तलाशे, प्रभावी दवाइयां बनाई. आज हमारे डॉक्टर्स ही कोरोना के प्रोटोकॉल्स बना रहे हैं, उन्हें लागू करवाने में मदद कर रहे हैं. ये वायरस नया है, इसमें नए नए म्यूटेशंस भी हो रहे हैं, लेकिन हमारे डॉक्टर्स की नॉलेज, उनके एक्सपीरियंस, उनके अनुभव वायरस के इन खतरों और चैलेंजेस का मिलकर मुकाबला कर रहे हैं.
The Prime Minister said government is committed to the safety and security of the doctors. The Prime Minister paid tribute to the doctors who lost their lives during the COVID-19 pandemic. He thanked the doctors on behalf of 130 crore Indians for their services during the pandemic.
आज जब देश कोरोना से इतनी बड़ी जंग लड़ रहा है, तो डॉक्टर्स ने दिन रात मेहनत करके लाखों लोगों का जीवन बचाया है. ये पुण्य कार्य करते हुए देश के कई डॉक्टर्स ने अपना जीवन भी न्योछावर कर दिया. मैं जीवन आहूत करने वाले इन सभी डॉक्टर्स को अपनी विनम्र श्रद्धांजलि अर्पित करता हूं और परिवार के प्रति अपनी संवेदना व्यक्त करता हूं.
The Prime Minister called upon the doctors to inspire the people to get vaccinated and adopt COVID-appropriate behavior. He commended the medical fraternity for spreading awareness about yoga. The Prime Minister praised the doctors for doing evidence-based studies on the benefits of yoga for dealing with post-COVID complications. Mr. Modi also suggested that studies on yoga could be published in international journals. Stressing on the importance of documentation of experiences of doctors, Mr. Modi has said symptoms of the patient's treatment plan and responses must be documented. He said COVID pandemic can be a good starting point for this exercise. The Prime Minister emphasized on the study of vaccine efficacy and early diagnosis for the better understanding of the disease. Entire world is appreciating doctors and medical fraternity's role in tackling the COVID-19 pandemic. Recently, Wimbledon crowd gave a standing ovation for Sarah Gilbert, Professor of Vaccinology at the University of Oxford, who led the team that developed the AstraZeneca vaccine. This is how science should be celebrated.
Today, they include leaders who have developed the anti-COVID vaccines,
The Prime Minister of India has said that 6 years of Digital India program marks rapid strides that the country has taken in adoption of technology. Mr. Modi said during the last 6 years, people's lives have been transformed with Digital India. Addressing a function to mark 6 years of the government's flagship program, Digital India, he said the vision of minimum government and maximum governance will be fulfilled with the help of Digital India.
मिनिमम गवर्नमेंट मैक्सिमम गवर्नेंस के सिद्धांतों पर चलते हुए सरकार और जनता के बीच, सिस्टम और सुविधाओं के बीच, समस्याओं और सर्विस के बीच गैप कम करना, इनके बीच की मुश्किलें खत्म करना और जन सामान्य की सुविधा बढ़ाना ये समय की मांग रहा है और इसलिए डिजिटल इंडिया सामान्य नागरिक को सुविधा और उनके एम्पावरमेंट का एक बहुत सशक्त माध्यम है.
Mr. Modi said Digital India is the sadhana of Atmanirbhar Bharat and is the slogan for becoming a stronger India in the 21st century. The Prime Minister said DigiLocker is a good example of how effective Digital India has been. Now all important documents, including school and college documents, Aadhaar, PAN and voter ID card can now be stored easily and securely in Digital Locker. He said that Digital India has played a key role in providing healthcare facilities to different parts of the country as platforms developed for online education to medicine is benefiting crores of Indians. Mr. Modi added that be it driving license, birth certificate, paying electricity and water bill, filing income tax return and other works have now become very easy and fast. Talking about the benefits of Digital India during COVID, the Prime Minister said people from remote areas are getting benefits of e-Sanjeevani, especially during the pandemic. He added Digital India and CoWIN are helping the country during vaccination. CoWIN has also attracted interest from several countries across the globe. The Goods and Services Tax GST system, the India's biggest tax reform, completes 4 years on Thursday. During these years, several key policy initiatives were taken by the government to make the GST system and compliance mechanism simple, transparent and technology-driven. GST is a remarkable example of cooperative federalism wherein all the decisions have been taken in GST Council through consensus. Prime Minister Narendra Modi has said GST has been a milestone in the economic landscape of India. Mr. Modi said it has decreased the number of taxes, compliance burden and overall tax burden on the common man while significantly increasing transparency, compliance and overall collection. The Finance Ministry said the government will honour 54,439 taxpayers. Minister for Road Transport and Highways Nitin Gadkari has also said that GST will help achieve the vision of $5 trillion Indian economy by 2025.
The Government of India has said that its national COVID vaccination program is built on scientific and epidemiological evidence, WHO guidelines and global best practices. The Health Ministry said the vaccination program is anchored in systematic end-to-end planning and is implemented through effective and efficient participation of states and union territories and the people at large. It said the government's commitment to the vaccination program has been unwavering and proactive from the beginning. India has administered over 27,60,000 COVID vaccine doses to eligible beneficiaries during the last 24 hours. With this, more than 33 crore 57 lakh vaccine doses have been administered so far under the nationwide vaccination drive. The country has registered further improvement in the recovery rate, which has now increased to 96.97%. In the last 24 hours, 1,005 deaths were reported in the country.
Capital city Dhaka wore a deserted look today as the country launched its week-long strict lockdown to face the sharply rising COVID-19 pandemic in Bangladesh. The government of Bangladesh has announced a week-long strict lockdown between July 1st to 7th as the coronavirus cases mounted in the country. On Wednesday, the sample positivity rate crossed 25%, even as the number of new infections in a day reached the record level of 8,822 in the country. Indonesia has announced a lockdown on its main island Java, as well as the tourism destination of Bali. The announcement by President Joko Widodo comes as the country battles multiple outbreaks and an alarming spike in COVID cases. Indonesia recently recorded 2 million COVID variants.
Thailand has welcomed its first quarantine-free tourists back to the island of Phuket as the country tries to reboot its tourism industry. About 250 people, mainly from the Middle East, were expected to arrive on 4 flights today as part of the Phuket Sandbox scheme. None of the arrivals need to quarantine, but they cannot travel to the mainland within 14 days. It is hoped the scheme will bring in $278 million in the next 3 months, but that is still far short of Thailand's pre-pandemic revenue from tourism, which accounts for about a fifth of the country's economy. According to news agency Reuters, Thailand lost around $50 billion when visitor numbers plunged following the start of the COVID-19 outbreak in 2020. If successful, the country will roll out the scheme to other islands with borders scheduled to open more fully in October. Russia reported 672 coronavirus deaths over the past 24 hours, according to a government tally, setting a pandemic high of fatalities for the third day today in a row. The country is battling a surging outbreak driven by the highly infectious Delta variant and worsened by a lagging jab drive, with President Vladimir Putin urging Russians on national television yesterday to get vaccinated. Moscow Mayor Sergei Sobyanin has said that the Delta variant accounts for 90% of cases in the Russian capital. Russia, with 135,886 deaths from the virus, has the highest official toll from COVID-19 in Europe.
The World Health Organization has said over 2 months of declining COVID cases in Europe had come to an end, warning a new wave would come unless remain disciplined. WHO's regional director for Europe, Arne Kloog, told a press conference last week the number of cases rose by 10%, driven by increased mixing, travel, gatherings and easing of social restrictions. The World Bank has announced it has increased its COVID-19 vaccine fund for developing countries by $8 billion to $20 billion. In addition, the bank's private financing arm secured a €600 million package for a South African vaccine manufacturer to ramp up production, the institution announced. Together, the actions announced on vaccine production, deployment and financing will save lives, boost economic recovery and help ensure the people in the developing countries have a chance to prosper. World Bank Group President David Malpass told reporters the $20 billion will be available through 2022 to finance vaccine distribution as well as cold chains and training health workers, the bank said in a statement.
Pregnancy during the times of COVID-19 could be an extremely stressful period for the mother, child and the entire family. In this regard, WHO has released a series of explainers to help educate people by answering some of the recurring questions on pregnancy and COVID-19. WHO's maternal and prenatal healthcare specialist, Dr. Ozge Tunchalp, advised women who are pregnant or are planning pregnancy to follow the same precautions as others to lower the risk of infection.
Pregnant women should take the same precautions to avoid COVID-19 infection as other people. You can help protect yourself and your family by cleaning your hands, keeping physical distance, when not possible and in crowded places, wearing a mask, opening windows as much as possible, practicing respiratory hygiene when coughing and sneezing, and where available and appropriate, getting vaccinated. At the same time, it is very important to follow routine care appointments during pregnancy and after birth for yourself and for your baby, keeping a healthy diet and exercise, taking care of your physical and mental well-being, and planning your birth.
Dr. Tunchalp also spoke about the steps that an expectant mother can take during childbirth and pregnancy.
Health systems around the world are under a lot of pressure right now, and sexual and reproductive health services are quickly disrupted when in situations like these. But pregnancy is not put on pause in a pandemic, and neither are every person's fundamental human rights. So it's very important that women who are pregnant or considering a pregnancy at this time know what they should expect. And the message from WHO is very clear. Safe and respectful pregnancy, childbirth, and postnatal services are essential to maintain. All pregnant women and their newborns, including those with confirmed or suspected COVID-19 infections, have the right to high-quality care before, during, and after childbirth, and that includes mental health care. And what do we mean when we say a safe, positive, good quality childbirth experience? It's about being treated with respect and dignity, having a companion of choice present during childbirth if you choose to do so, clear communication by maternity staff, appropriate pain relief strategies, and mobility in labor where possible and birth position of choice. And after birth, women and babies should be enabled to remain together, practice skin-to-skin, rooming in, and supported to initiate and continue breastfeeding.
On the question of what a pregnant woman could do if she contracts COVID, Dr. Tunchalp explains what needs to be done in such a situation.
Being pregnant is not an additional risk for getting COVID, but we also know that pregnant women are at higher risk of getting severe COVID and at higher risk of delivering a baby prematurely. What's important is that you know what to do. If you have COVID and if you have fever, cough, difficulty breathing, seek medical care early. This can help minimize the risk. Ask your healthcare provider for advice about managing common COVID symptoms so you can make the right decision together. Preparedness is very important here. Make sure you know where to go if your symptoms worsen or if you have any other complications. Your healthcare provider can guide you on what to do in case there are movement restrictions or curfews in the place you live. And I can't emphasize enough the importance of keeping regular pregnancy and post-pregnancy checkups. Make sure that any contacts that you missed for antenatal or postnatal care are rescheduled. And in some cases, you may have the possibility to have these contacts through telemedicine or by phone or even home visits. And in terms of risk for the baby, mother-to-baby transmission in utero or during birth is very rare and no active virus has been identified in breast milk. So this is important to keep continuing with breastfeeding. And as far as we know, babies born to women who have had or currently have COVID do well and in general don't present with symptoms. In case newborns are infected, most of the time they present with symptoms that are not very severe.
This is All India Radio, giving you the world news.
The centre is disseminating awareness of national helpline numbers for the benefit of citizens during the COVID-19 pandemic. The helpline number of the Health and Family Welfare Ministry is 1075. The child helpline number is 1098. For senior citizens of Delhi, Karnataka, Madhya Pradesh, Rajasthan, Tamil Nadu, Telangana, Uttar Pradesh and Uttarakhand, the helpline number is 14567. The helpline number of National Institute of Mental Health and Neurosciences, NIMHANS, for psychological support is 08046110007. Ayush COVID-19 counselling helpline number is 14443 and MyGov WhatsApp help desk number is 9013151515.
Welcome back to the World News. India and Pakistan today exchanged through diplomatic channels simultaneously at New Delhi and Islamabad the lists of civilian prisoners and fishermen in their custody. This is in keeping with the provisions of the 2008 agreement, under which such lists are exchanged every year on 1st of January and 1st of July. External Affairs Ministry said India handed over lists of 271 Pakistani civilian prisoners and 74 fishermen in India's custody to Pakistan. Pakistan has shared lists of 51 civilian prisoners and 558 fishermen in its custody who are Indians or are believed to be Indians. Government has called for early release and repatriation of civilian prisoners, missing Indian defence personnel and fishermen, along with their boats from Pakistan's custody. In this context, Pakistan was asked to expedite the release and repatriation of one Indian civilian prisoner and 295 Indian fishermen to India, whose nationality has been confirmed and conveyed to Pakistan. In addition, Pakistan has been asked to provide immediate consular access to 194 fishermen and 17 civilian prisoners who are in Pakistan's custody and are believed to be Indian. India also requested Pakistan to expedite the grant of visas to the members of the medical experts team and facilitate their visit to Pakistan to assess the mental condition of believed to be Indian prisoners of unsound mind lodged in different jails of Pakistan. It was also proposed to organize an early visit of the Joint Judicial Committee to Pakistan. External Affairs Ministry said India remains committed to addressing all humanitarian matters, including those pertaining to prisoners and fishermen in each other's country. India has also urged Pakistan to expedite necessary action at its end to confirm the nationality status of 78 Pakistan prisoners, including fishermen, whose repatriation is pending for want of nationality confirmation by Pakistan. In view of the COVID-19 pandemic, Pakistan has been requested to ensure the safety, security and welfare of all Indian and believed to be Indian civil prisoners and fishermen.
Defence Minister of India, Mr. Rajnath Singh, today held talks with his Vietnamese counterpart, Senior Lieutenant General Phan Van Giang. In a series of tweets, Mr. Singh said, India and Vietnam have a strong and effective relationship and New Delhi attaches great importance to the bilateral defence cooperation with that country. He added that both countries share a long-standing tradition of helping each other in difficult times and have achieved substantial progress in defence industry cooperation in recent years. The minister also said the two countries continue to make forward movement in overcoming the challenges posed by COVID-19.
Indian Army Chief General Manoj Naravane today said that the capabilities to deal with drone threats both in kinetic and non-kinetic realm are being enhanced. General Naravane said the easy availability of drones allowed both state and non-state actors to use them and increased the complexity of challenges faced by the security forces. He added that they have put in place certain measures so that all troops get sensitized to this evolving threat. Speaking at a function, General Naravane said that there will always be elements who will try to sabotage process of peace and development. He, however, said since there is no infiltration, number of terrorists in Kashmir is lesser.
Prime Minister Narendra Modi has said the positive experience that Afghanistan Ambassador Farid Mamunzeh had with an Indian doctor has the sense of India-Afghanistan relations. The ambassador had posted a moving account in Twitter of his visit to an Indian doctor who refused to charge him upon learning that his patient was the Afghan ambassador to India, saying that he will not charge a brother.
President Xi Jinping has warned that China will no longer be bullied by foreign forces. He was addressing a gathering at Tiananmen Square on Thursday during centenary celebrations of the founding of the ruling Communist Party of China, CPC. President Xi, who heads the party, is seen as considering a third term for him starting next year. More than 70,000 people consisting of party and military officials besides school children and university students attended the event, according to the official Xinhua news agency. Indian tennis player Sania Mirza made a winning return to the Wimbledon 2021 as she stormed into the women's doubles round 2 at the championships in London on Thursday. Sania, who is competing at the Wimbledon after 2017, teamed up with American Bethany Mattek-Sands once again to beat the six-seeded duo of Alexa Gaurachi and Desiree Krosik 7-5, 6-3 in their opening match at Court 8. Sania Mirza's form at Wimbledon will be crucial for India as she will be headlining the tennis contingent at the upcoming Olympics later this month. Earlier in men's singles, world number 1 Novak Djokovic entered the third round on slick grass, beating Kevin Anderson. Kei Nishikori of Japan ousted Alexei Popyrin for his 100th Grand Slam match win. In the women's section, second seed Adina Sabalenka of Belarus overcame British wildcard Katie Bottler to reach third round. Bianca Andreescu of Canada was shocked by France's world's number 58, Alice Cornet.
In the run-up to the Tokyo Olympics, the News Services Division of All India Radio in its Sports Scan program is broadcasting every day Olympics quiz with AIR News. Olympics quiz Akashvani Samachar ke saath in Hindi. Every day a question related to Olympics will be asked at the beginning and closing of the program. To participate in this program, listeners can send the replies by email on airsportscan@gmail.com. The first correct answer received through email will be adjudged the winner of the quiz. The name of the winner will be announced in SportsScan program the next day. It will also be flashed on AIR Twitter handle @AIR News Alerts. The Sports Authority of India will provide India team jersey to the winner. So tune in to the SportsScan program every day at 7:20 p.m. on FM Gold and on our YouTube channel, News on AIR Official.
With around 22 days remaining for the start of the Tokyo Olympics, All India Radio brings a special series on India's medal prospects at the sporting extravaganza. Today we will talk about the young gymnast of West Bengal, Pranati Nayak.
Pranati Nayak is representing India in gymnastics at the Tokyo Olympics. Pranati started her gymnastic career from Kolkata in 2004 despite many challenges. Pranati made a big breakthrough in her gymnastics journey when she made the country proud by bagging a bronze medal at the 2019 Asian Championships in Mongolia. Pranati secured her Olympic qualification through continental quota. In an exclusive interview with AIR News, Pranati shared her first reaction on her qualification.
अच्छा लग रहा है सर बहुत कि मैं ओलंपिक खेलने के लिए जा रही हूँ और इंडिया का रिप्रेजेंट करूँगी.
Pranati shared AIR News about her gymnastic journey. Pranati spoke on her preparedness amidst the challenges during the COVID-19 pandemic.
सर उस टाइम तो बहुत मुश्किल था क्योंकि कलकत्ता से मेरा घर मेदिनीपुर है, 5 घंटे का रास्ता है. कलकत्ता ना मतलब उस टाइम बहुत बड़ी बात. कलकत्ता शहर मतलब हम लोगों के पास जैसा अभी कहीं दिल्ली जैसा है वैसा ही गांव से कलकत्ता आना बहुत बड़ी बात थी. कलकत्ता में आके हम स्टेडियम में रहने लगे पापा और मम्मी के साथ, और क्योंकि रेगुलर आना जाना मुश्किल था हम लोगों के लिए इतना दूर से, तो यहाँ पे आके मैंने अपना प्रैक्टिस स्टार्ट किया 6 महीना. उसके बाद मेरा हॉस्टल हुआ साई में 2004 में. जब मैं फर्स्ट नेशनल खेली 2004 में मुझे गोल्ड मिला फर्स्ट नेशनल पे. उसमें पता चला कि धीरे धीरे के 4 अपैटस है और हम चाहे तो 4 अपैटस में भी गोल्ड ले सकते हैं. तो
Now let us take a look at the major developments around the world as reported in the foreign press. Washington Post writes that Trump Organization CFO surrenders in criminal case over company's dealings. Sputnik News writes that Russian fleet monitoring Italian frigate that entered Black Sea. Wall Street Journal writes that Delta variant hobs global efforts to lift COVID-19 restrictions. A quick look at the headlines once again. Prime Minister of India, Mr. Narendra Modi, thanks doctors on National Doctors' Day for their services during COVID-19 pandemic. Digital India is a slogan for a stronger India in the 21st century, says Indian Prime Minister. India and Pakistan exchange list of civilian prisoners and fishermen in their custody. Thailand welcomes its first quarantine-free tourists back to island of Phuket, and in Wimbledon tennis, Sania Mirza and her American partner advanced to second round in women's doubles. India is celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let us listen to his favorite bhajan, Vaishnav Jan, by artists from Mauritius. On the National Doctors' Day, we salute the doctors for their selfless service for humanity during the COVID-19 pandemic. And with that, we end this bulletin. We'll be back at the same time tomorrow with the next edition of World News.